I'm what you might call a coal-face rheumatologist. I don't come from an academic unit, but I hope I can bring to you what's going on at ground level in terms of managing this disease. So, as has already been said, rheumatoid arthritis is an old disease. It was first, evidence of it has been picked up as far back as 4,500 years before Christ, BC, based on the bones of Native Americans found in the USA and Tennessee. And it's interesting to note that even today, Native Americans tend to acquire the disease more often than people in other ethnic groups. Rheumatoid arthritis is the most prevalent chronic inflammatory arthritis, affecting 1% of the global adult population. It's characterized by inflammation of synovial tissue, which, if untreated, as most of you will know, leads to irreversible joint damage and eventual long-term disability. Despite the fact it's been around for a long time, we still don't really know what causes it. We're getting better at treating it, but curing it is impossible, and getting patients into remission even now isn't easy. Not only is it a joint disease, but it has serious extra-articular manifestations, as illustrated by a couple of these pictures here. Episcleritis, for example, which is vasculitis affecting the eye. Cardiovascular disease, become increasingly evident in recent years that this is a problem in patients with rheumatoid arthritis. The risk of cardiovascular disease is as much of a problem in a rheumatoid as it is in diabetes mellitus, for example. I'll talk a bit about this later, but largely related to the presence of C-reactive protein in high levels for relatively long periods. And just as importantly, rheumatoid arthritis leads to premature mortality. You see on the lower slide an example of small vessel vasculitis, not so often seen in the UK in rheumatoid arthritis, but nevertheless still a problem. So rheumatoid has a significant economic impact, and comparable with that of coronary heart disease. The mean cost per patient in the UK is £3,500 a year. And in the UK, 9.5 million working days are lost per year. And 50% of individuals are unable to work at 10 years after onset. And a recent survey done by NRAS, published in 2007, showed that in the UK, 28% of patients have to alter their type of work or are unable to work after 1 year of disease. So this has a significant impact. Life expectancy, as I said earlier, is reduced. In fact, in women it's reduced by 5 years and in men by 7 years. Deaths come from cardiovascular disease, infective problems and respiratory problems. I wonder if I could ask for a drink of water, please, to someone who's handy. So as I said earlier, this is an old disease, but I want to present to you some new approaches in management. And the management has changed dramatically in recent years, and this is thanks to a better understanding of the biology and natural history of the disease. And traditionally, rheumatoid was diagnosed late in the course of disease. I'm just going to say a little bit about that, and this is how it was in the UK. In the 70s and 80s, largely, things began to change in the 1990s. Traditionally, patients were treated symptomatically with anti-inflammatory, non-steroidal anti-inflammatory drugs, and referral to a specialist team was delayed. DMARDs, or disease-modifying anti-rheumatic drugs, were only introduced in certain circumstances, and these circumstances were if symptomatic treatment had failed, or if there was evidence of joint erosion on X-ray, or if extra-articular complications had started to develop, such as you see here, a good example of erosive change in the metacarpophalangeal joints, a nasty vasculitic ulcer produced by a rheumatoid. This particular lady actually was a patient I dealt with when I was a registrar, and she'd had rheumatoid for several years, and she was admitted for months on the ward and treated with high-dose prednisolone and cyclophosphamide. It did eventually heal. We don't see so much of that in the UK now, thanks to the earlier introduction of disease-modifying drug and the anti-TNF drugs. And alongside this, we were catching patients much later in the course of the process. They weren't referred to a specialist team really until the thing was quite well established. So you could say that up until the 1990s, or perhaps within the last 10 years. Thank you very much.